Any views expressed in this film are those of the artists, recorded as part of the Future is Loading exhibition.
Hi, I'm Rudy Loewe. I'm a visual artist and artist educator. My pronouns are they, them. I work with different kinds of topics like Black history, colonialism, gender, sexuality, and how these themes can be looked at through painting, drawing, and printmaking. I am a light-skinned Black mixed-race person with two long braids, glasses, a nose ring, uh, a cowrie shell necklace, and a little beanie hat.
Hi, my name's Tobi, pronouns they, them. I'm an interdisciplinary artist. I work mostly with mediums around visual, in terms of like video and sound, in terms of poetry and singing, kind of incorporating harmonies into my work. A lot of my topics and themes revolve around healing, ancestral language, and just coming back to nature. So my description, image description, I am a dark-skinned Black femme with gold hair and a little tuft of a lock growing on the left side of my head. I'm wearing an abalone shell necklace. I have one earring in my right ear and two nose piercings, one in my septum and one in my actual nose, which is a circular ring, a spiral ring.
And you have beautiful lipstick.
Yes, a beautiful purple lipstick. Thanks, Rudy.
We're having this conversation today alongside the Shape Arts exhibition, The Future is Loading, really just to talk about disability justice, you know, in this time of COVID-19 and the global pandemic. Our next topic was thinking about an intersectional understanding of disability justice. So I guess we should probably just say, for anyone who doesn't know about intersectionality, this is the different, you could say, strands of oppression that a person might experience, whether it's gender, sexuality, race, disability, class, and how a person can experience multiple oppressions at the same time, that they're at the intersections of multiple oppressions.
Yes. And the term was coined by someone called Kimberly Crenshaw, who's an amazing Black activist, organizer, who's been working for change within our communities, like globally. And so if anyone wants to look that up, it's a really good place to start thinking about transformative work, transformative justice, and, you know, activism that centers intersectional ways of creating. I think the intersectional part is just so important because it's a thing of it doesn't matter who is in the space. The question really should be who is not in the space and why are they not able to be here, and how do we change that, and how do we make it accessible for them, or even like how do we make that an option, you know?
Yeah, I think about the ways in which people, you know, for example, have access to healthcare, or thinking about diagnoses, how people get diagnosed, who gets diagnosed, like who has access to certain kinds of care, who gets criminalized. And all of this is definitely bound up in intersectionality. You know, I've been thinking a lot recently about kind of autism and people who, or especially like women or people who are perceived as women, being diagnosed as having borderline personality disorder. And like, so there's all these different dynamics as well happening when it comes to disability that I think it's important to be aware of, or how, like, you know, a lot of Black people who have mental health issues end up being institutionalized and criminalized, and how all of these dynamics are part of disability justice.
Yeah, definitely. And also just, you know, how we need to really leave all our assumptions and presumptions of what disabled people look like at the door, like 100%. That, like, we need to be able to hold space for the conversations, but also not assume that, you know, someone's okay just because you look at them and they look fine, because everybody's dealing with their own different thing, whatever that is. You might not know, but, you know, making assumptions is just further excluding people from our communities that need the space, especially Black and brown people in our communities who, people make assumptions and judgments just based off of one look, and that means that their access is entirely different. Their access to healthcare sometimes is non-existent when they're the ones who are needing these things the most. And it's a conversation, obviously, that needs to happen on a structural level as well as a communal level. But to begin here and to begin with us just talking amongst ourselves, with us using our privilege and our energy and our capacities to have conversations with people who might, not know this information or be privileged enough to not even have to think about it, is such a big step forward. And it's unfortunate that it's not consistently happening. So just challenging ourselves to constantly do better and challenging ourselves to remember to hold these conversations when we have the capacity is so important.
Yeah, I was thinking about this statistic I read recently, which it was for the US, but it was talking about how a really high proportion of Black people who experience police brutality are disabled, but are not being read as disabled by the police, and instead are being criminalized. Yeah, like you're saying, I think also how can other disabled and also non-disabled people be thinking about how to support disabled folks to have better access to resources, which again, it comes back to things like the mutual aid, but it was also just like the way that doctors are more receptive to people with lighter skin, right? And having someone who's more light-skinned coming to an appointment with you, or like someone who understands certain kinds of medical language, who like how we access care, and how we can make these systems to support each other so that we can all have better access to care.
That's a good point, because for me, just as a personal individual example of what Rudy was just talking about, I did not get any diagnoses. Like I knew what was wrong with me. I knew exactly what was going on. I knew what the support was I needed. But every time I went to my doctor, I wasn't being believed, until I started taking white people with me to my appointments, until I started taking my light-skinned friends with me to my appointments. And then the doctors would address my friends and give them all the support that I was asking for.
I mean, I remember it happened one time when I came with you and I was like, am I the patient here?
Yeah, it happens all the time. And that's such an easy way of, thinking about our capacity and how we use that for actual transformative change, because this is now just factual information. We know that there is a bias that exists. We know that, NHS staff get trained, but, in overcoming this bias, but that doesn't necessarily change their thoughts, their opinions, or the ways that they react to darker skinned bodies or bodies that have, higher proximities to Blackness. What changes it is then you, as somebody who might have that privilege of being of a closer proximity to whiteness, supporting your darker skinned friends, like helping them, access things that might not be possible if you weren't going with them to their appointments, and this is just a singular example, and it can be applied to a lot of different, different parts of our lives. If we're talking about, you having access to journals because you studied to a PhD level, so then your friends who didn't go to uni want to read about something that they don't have access to but directly relates to their experience, you can just download these files and send them in an email. It's easy to think about our privileges, and it's also so much easier for us with privileges, or people with privileges, to use them than for people who don't have access and don't have this privilege to find the access on their own. That, by the time they found it, they're probably too exhausted to even use what it is that they were looking for in the first place.
That like you're having to advocate for yourself all the time, and I think there are situations where people are aware already that they might need an advocate for, but there's like a micro level of experience, kind of like the hospital visits and things like this, where people wouldn't necessarily think that they would need an advocate for that, but also not receiving adequate healthcare, and then suddenly like Like if you do have an advocate, if you do bring a light-skinned person or a white person with you, suddenly you might realize that there's a whole level of healthcare that you haven't been receiving.
Exactly.
So our next topic was thinking about what does all of this mean as artists.
You can watch more of Tobi and Rudy's conversation and view the Future is Loading exhibition on our website at www.shapearts.org.uk.